why young Indians are dying of heart attacks. And most of the time, what we have seen that, these are silent heart attack these days. Why this is happening?
50% of the patients with the blockage in the coronary arteries have no symptoms, nearly 50%. They develop heart attack and they have no previous chest pain, especially diabetics. Diabetics have very little sensation in the heart. So in India, we are the diabetic capital of the world. That is the other compounding problem. So the heart attack was always happening. It is still happening. It is just that the awareness about the heart attack is much better now compared to what it used to be in the past. That's why you feel that the number of people developing heart attack has increased. It is just that there is a lot more discussion on the heart attack today. Yeah.
So, but we have seen that, people are doing exercising, they are falling while doing exercise. Yeah, the rate has been increased. Have you seen that, since these many years?
Yes, you see what happened. The biggest problem in our country is uh, people don't know that how fit they feel has nothing to do with how fit they are. You can have very serious heart problem, yet you may not be aware of it. So the people are refusing to go for a health checkup. Like you have seen so many people just dropping down dead on a treadmill or running marathon or day-to-day activities. If all these people, if they went for a basic check, like one blood test, a ECG, echocardiogram, and a cardiac CT scan, that's all. This can be done in any of the roadside diagnostic labs. None of those people would have had a heart attack, none of them, because the blockage would have been diagnosed and they would have been under treatment. So the problem of healthy people undergoing, the suddenly dropping down dead, this could have been eliminated completely if only people went for a health checkup. Our biggest problem is people refuse to see the doctors unless they have pain.
Sir, when should somebody get a heart checkup done?
Every Indian at the age of 17 must get the blood test done. This is the guideline now issued by the Cardiology Society of India. Because if the cholesterol level is high, they can manipulate the diet. And all the men at the age of 35 to 40 should undergo a routine test along with CT scan of the heart. And anyone with the family history of heart disease must go for the checkup at the age of 30 itself, not wait for a long time. All the diabetics should go for the checkup even earlier than 30 years, long-standing diabetics. So it is important that everyone should know their numbers. They should know what their blood pressure is, cholesterol number is, their heart numbers are. Then these things you won't find. Today we find a large number of young people getting into extreme sport. Even if you are very young, 17, 18, if you are going for extreme sport, you must go for a checkup. I'll give you simple data. All of you just Google FIFA, FIFA, Federation of Football Association. Then you write cardiac arrest. Then you will get series of articles published by FIFA that clearly shows that about 670 or so professional footballers had a cardiac arrest in the last 4 years. 670. This is what is documented. Undocumented cardiac arrest will be 10 times more. So you mean to say that we are fitter than a professional footballer who's 18 or 20-year-old, and they have this high incidence. So anyone wanting to get into extreme sport, they must go for a detailed cardiac checkup.
So, according to you, what is the best marker for heart disease? And, what are those trigger points and preventive measures that can be taken?
If you are waiting for the trigger points, most of the time you miss the bus. The best way to know what the cardiac point is, the cardiac problems are, get the test done. As I said, simple tests, which can be done within 1 hour, once a year. And if the CT scan is normal for the next 7 years or 10 years, you don't need to bother. Yeah.
Sir, some new initiatives have been taken by you, hiring nurses for administration role, nurses-led hospital, which is a very unique, a changing narrative kind of concept. What would you like to say about it?
See, if there is one person who knows everything about the patient and everything about the way hospital functions, these are the group of people called nurses. We spend hardly 1% of the patient time in the hospital. 99.99% of the time, they are with the nurses. So who knows them better than us? So they are the right people to manage them. They are the right people to understand how the hospital functions and put it in the right place. Unfortunately, there was no career structure built for them to become a CEO or the senior leadership of a hospital. So we want to create that. We want to show that given an opportunity, our nurses can manage a big hospital or even a conglomerate of hospital. Just give them the opportunity.
Sir, you must be aware about that, the excessive exposure of children for social media. How do you see this? What message would you like to give?
See, there is absolutely no doubt that the children should not be exposed to even screen when they are very small. But in India, it has become, in Asia especially, every child carries a device in the hand, and that is the best way to pacify the child. But I'm sure it has a lot of impact on the growth of the child. So the lot of countries have started banning the children from getting into social media, and I think India should strongly look into that aspect.
Sir, there is an alarming rate of young medical students and aspirants dying, primarily driven by the introspection or overwhelming academic pressure. Sir, what is driving the intense pressure on these students? What you would like to say, the message you wanted to give to these students?
See, it is very, very important. Yeah, I belong to the old school. The problem is youngsters must become spiritual. I'm not saying religious. I'm saying spiritual. Believing in someone called God or some superhuman power is a very, very strong stabilizing force. That is unfortunately is gradually fading away. That is one of the biggest problem. Then also the family tie, what it used to be in the past, is also gradually kind of a fading away. These are the two problems. It is very important that the medical students have to realize that it is a tough profession, no doubt, because you are dealing with life. So there is no question of compromising anywhere. But it is very important that they toughen themselves and withstand all the pressures. It is possible, provided you become spiritual and believe that there is somebody up there constantly protecting us and leading us in the right direction. That is the best navigation, what I can suggest to all these youngsters.
Sir, my last question is related to, sir, the Bengaluru incident that has happened in this daycare, sir. So, when we see such videos, so where are we moving? What exactly is lacking? What should be done?
Whenever a incidents like this happens, we must think that these incidences are happening 1,000 times more than what we think. Because this one incident which came to light, but there may be thousands of such things happening everywhere. We are not aware of it. And the only way to control it is by setting an example by tough punishment. The punishment, it is very sad that, we have to resort to these very tough measures. But otherwise, how are you going to protect the helpless kids? It is very unfortunate whatever has happened.